all the authoritarian has to do is tell you he's doing it, and you have no more information to know reality
Right.
otherwise, right? There's no independent data, no other sourcing. I've also started to see, and this is the time of RFK-jr.'s hearing for head of health and human services. So that makes the idea of vaccines come back up into the public conversation. The attack on the MMR, the measles, mumps, rubella. I don't understand the desire to prove that vaccines don't work when clearly we are living in communities that don't have polio that's endemic, that don't, we no longer die of flu at the rates of the Spanish flu, and we don't die of measles, mumps, and rubella, right? We have children are not dying of curable diseases. So
Yeah.
the idea that we are attacking vaccines at the federal government level and trying to put people in charge of our healthcare system and research who want to fundamentally undermine our herd immunity, it's like, okay, we have gone way beyond the Rubicon on this one. This is Trailblaze, your show where we talk about the America we are becoming. I'm your host, Nayyera.
I'm Jamal Simmons, and as we talk about the America we're becoming seems to be a scarier and scarier place every day, doesn't it, Nayyera?
Every day, and we're only a few days into this new administration, and there's a flood of information. So I want to break down one piece of that, and that is, where is our federal money going? I pay taxes. Lots of people pay taxes. Where is that money going? Because I can tell you where it's not going. According to 3 federal government ideas that have been floated in the last week. One, telling federal agencies they can no longer communicate with the outside world. So that meant that NIH could not recruit new people for studies. If you are out there with a rare form of cancer, you suddenly got told they were not allowed to talk to you about the treatment you were on, and that they could no longer find new people and new studies to continue treatment or even coordinate with other organizations that are doing all of this research. So scientific research and communication halted. Second, foreign aid just halted. And that's not just, bombs to Ukraine. I'm not talking about the military, the foreign humanitarian aid. So as people are going back into Gaza, the United States has helped give money, International Red Cross and Red Crescent, to help feed them. That was halted. Anything about helping with child education, PEPFAR, giving money for AIDS drugs to reduce the spread of AIDS in Africa. That was a George Bush program. That was an evangelical, Christian, huge, important program, halted. So those organizations decided, well, we don't know where we're going to get our money. We have to fire people and shut down operations. That's already happening.
I mean, you may know this, and but many people may not realize it. One of the things that happened when George Bush did PEPFAR, obviously, it's to stop the spread of HIV and AIDS. And of course, these diseases are always mutating. So the more bodies they're in, the more mutations we see, and they may come back. But also, when COVID happened, one of the things that was surprisingly helpful was these PEPFAR countries were resilient in terms of how they managed the COVID crisis because they had such infrastructure in those countries because of the PEPFAR program and dealing with HIV and AIDS. I just think we have these follow-on effects of the work that we do with foreign aid, which is only about $80 billion or something. We're not even talking about that much money out of the State Department. But it's had a great amount of effect for how we can help manage the problems that are occurring in the world.
Foreign aid is 1% of the federal budget. So a penny on the dollar of the federal budget. Because the federal budget, the rest of it, that's like $1 trillion, right? I know these are crazy numbers when you talk about 1 penny on the dollar and the benefit we get. That's why I mentioned and connect it to the idea of science and healthcare and what that does. If we are not communicating with the World Health Organization, we're not giving them data, we're not getting data. We're not allowing our scientists and researchers to communicate and connect. And we're very wishy-washy about what we're going to fund. After the week of chaos, the Trump administration decided that they're going to allow for certain humanitarian funding, but okay, what's the definition of that? That makes us far less prepared for bird flu, whatever the next pandemic may be. And it's coming. I mean, something is going to happen that we need to respond to as a global community, and we are not going to be prepared for it.
Well, here's the thing about it. It's coming is what we know now is that it's already out there. Right? Is that these things are already out there. The question is, will it propagate to the point where it's on our doorstep and we're all, again, shut down and we can't interact in some way? Mm-hmm. That's the thing. But all these things are already out there. And so we constantly have these monitoring programs and these mitigation efforts to try to stop whatever threats that exist from growing to the point where they are a global pandemic or can do harm to people here in the United States. It's not just do good money. They're not just taking advantage of us. It's like the war in Ukraine. We're not just giving people money in Ukraine because we really care so much about the country, although we do, we want them to be free. But if we can stop the Russian aggression at the doorstep of Europe or in Ukraine, that means we're not going to have this problem in Finland, and we're not going to have it in France or in Poland or someplace else. We can deal with these problems before they become such tragic metastasized crises that we're really paying a lot of money and we're sending American troops to go help fight these fights.
Yeah, this idea that we can go back to a world where the United States is not connected to anybody else is just, it's never going to happen. It's not. We are a globalized community. There are people flying for commercial reasons, for personal reasons. The technology allows us to all talk halfway across the world. Like, that's the reality. And there are ways to protect the American worker, ways to protect American values, but shutting down data and information to the point where states don't know what other states, what cases they have. The reporting back and forth is not there. The anticipation or understanding of what happened to pop up in the Middle East or what popped up in mainland China, we don't have that system right now. What we have right now to protect ourselves is a government that wants to bury its head in the sand and say that nothing is happening, right?
Well, you know what this is. I mean, listen, I tried not to get too far off into the conspiratorial, dunk hole, but the reality, I think, is becoming clear that part of plunging us into chaos gets back to the only I can fix it mantra of this guy who's in charge. And so, if everything's in chaos, nobody's around to fix it, somebody has to come in and do it. And all of a sudden, it becomes much more palatable to have a single entity, authoritarian figure who comes in and solves the problem, because the other alternative is chaos and anarchy. So you've got to let the authoritarian do it, because there is no more civil service. There is no more infrastructure to manage this. And we'll throw out effective government.
Even better. All the authoritarian has to do is tell you he's doing it, and you have no more information to know reality otherwise, right? There's no independent data, no other sourcing. I've also started to see, and this is the time of RFK-jr.'s hearing for head of health and human services. So that makes the idea of vaccines come back up into the public conversation. The attack on the MMR, the measles, mumps, rubella. I don't understand the desire to prove that vaccines don't work, when clearly we are living in communities that don't have polio as endemic, that don't, we no longer die of flu at the rates of the Spanish flu, and we don't die of measles, mumps, and rubella, right? We have children are not dying of curable diseases. So the idea that we are attacking vaccines at the federal government level and trying to put people in charge of our healthcare system and research who want to fundamentally undermine our herd immunity, it's like, okay, we have gone way beyond the Rubicon on this one.
Well, let's keep it all the way real for people about, all the cuts that have taken place. The thing that happened after the foreign policy cuts was the domestic policy freezing of funds and grants. And so you had people worried about student loans. You had women who were pregnant or just had children worried about the Women, Infant, and Children program, which, by the way, I was a recipient of when I was a small kid, when my mom had to be on WIC. We don't have people who are worried about making sure that the Medicaid interface went down because people didn't know what to do. All these small things. And we think this is just like, Medicaid is just going to go to that poor, black guy or black woman in some inner city. No, Mississippi, Alabama, Indiana, all these red states where people are recipients of government aid are now realizing, when you say you want to cut government down and shut it down, that means the stuff that you depend on is going to go away.
Yeah, in Obamacare era, there was the activism of keep government at my Medicare, keep government at my Medicaid. I'm like, y'all, those are social safety net programs funded by the federal government. That is fundamentally something that we have used our taxpayer dollars to do collectively, and say, we want to take care of old people in this country. We want to give them something to live on. That's regardless of whether they're black or white. There are a lot of poor white people out there too. And I am struck by this one story coming out of Texas, in which this woman who was hired by the Department of Veterans Affairs to help process disability claims, because those are woefully behind. It takes ages to figure out whether or not you're going to get the benefits you were promised. And her husband had sold their home, were planning to move, and suddenly the federal hiring freeze meant she couldn't start her job. And they were out at least $6,000 out of a job, out of a home. And she posted saying, I don't think you meant this for us, President Trump. This was not meant for us. Well, if you are the recipient of any federal aid, if you use a Head Start program, use VA benefits, the federal freeze is for you.
The federal freeze is for you. Listen, it's happening everywhere. And I am not sure that there's a way out of this that doesn't involve people experiencing some extraordinary amount of pain, because we need to know what it is that we're signing up for, and perhaps Americans will see it. And you'll see people literally taking to the streets. I mean, that may be the only thing that stops this, is that there are so many people in enough congressional districts and states who are saying no, that they finally put some backbone behind these weaselly members of Congress and senators who are just laying down and allowing this to happen. And I got to tell you, if I'm a Republican, I'm watching what Trump did to the former members of his administration, like Mike Pompeo, who were being threatened by international powers to come after them and kill them, and then takes away the security from these people because he's mad at them, right? We saw already what happened with Mike Pence. Now we see it with Pompeo. We see it with John Bolton. Why would you give power to his minions to come take over the national security parts of the government, the law enforcement parts of the government? Why would you give them more power? Do you think that with more power, he's not going to then decide to sick them on you or your family members if you get on the wrong side of Donald Trump?
Well, if you're John Fetterman, the relatively new senator from Pennsylvania who's a Democrat, why are you going down to Mar-a-Lago, and why are you being the decisive vote to appoint a Secretary of Defense who's going to go after former military generals? And it's that same question about power. How long do you think you're going to be able to have that power? Only as long as Donald Trump wants you to have it.
Yep.
That's it.
Yep. And the more you give him, we've seen this with him for the last 6 years. The more you give him, the more he takes, and he does not have any loyalty to anyone other than himself.
There it is, Jamal.
There we go. All right. Well, good to see you. Let's keep doing this as long as they let us.
I decided that if I'm going to be hauled off by accident, I do travel and carry my passport card with me, but I will try to live view it, and maybe I'll have the ability to send it to you or somebody else and be like, hey, can you please find me? I'm over here.
Yeah,
that's my only solution right now, folks.
Please do. I will do everything I can to spring you.
Thank you.
I know people.